Anterior cruciate ligament reconstruction is a very common and successful procedure. It is usually indicated in patients who desire to return to an active lifestyle. Cruciate ligament is one of the 4 major ligaments of the knee that connects the femur thigh bone and helps stabilize your knee joint. Anterior cruciate ligament prevents excessive forward movement of the lower leg bone, the tibia, in relation to the thigh bone, the femur, as well as limits rotational movements of the knee. A tear of this ligament can make you feel as though your knees will not allow you to move or even hold you up. Anterior cruciate ligament ACL reconstruction hamstring method is a surgical procedure that replaces the injured ACL with a hamstring tendon. Causes. An ACL injury most commonly occurs during sports that involve twisting or overextending your knee. An ACL can be injured in several ways. Sudden directional change, slowing down while running, landing from a jump incorrectly, direct blow to the side of your knee, such as during a football tackle. Symptoms. When you injure your ACL, you might hear a loud pop sound, and you may feel your knee buckle. Within a few hours after an ACL injury, your knee may swell due to bleeding from vessels within the torn ligament. You may notice the knee feels unstable or seems to give way, especially when trying to change direction on the knee.
ACL injury can be diagnosed with a thorough physical examination of the knee and diagnostic tests such as X-rays, MRI scans, and arthroscopy. X-rays may be needed to rule out any fractures. In addition, your doctor will often perform the Lachman's test to see if the ACL is intact. During a Lachman test, knees with a torn ACL may show increased forward movement of the tibia and a soft or mushy endpoint compared to a healthy knee. The goal of ACL reconstruction surgery is to tighten your knee and to restore its stability, performed under general anesthesia. Your surgeon will make 2 small cuts about 1/4 inch long around your knee. An arthroscope, a tube with a small video camera on the end, is inserted through one incision to see the inside of the knee joint. Along with the arthroscope, a sterile solution is pumped into the joint to expand it, enabling the surgeon to have a clear view and space to work inside the joint. The knee is bent at right angles and the hamstring tendons felt. A small incision is made over the hamstring tendon attachment to the tibia, and the 2 tendons are stripped off the muscle and the graft is prepared.
The surgeon will insert a probe to inspect the damaged joint. A small motorized shaver will then be used to remove the damaged ACL and prepare the area for the new one. In every case, a surgeon will also inspect the entire joint to determine whether there is additional damage warranting other repairs. Then, the surgeon will use a device called a retro-flip cutter to create a tunnel through the femur and into the knee joint. We'll also create a tunnel through the tibia and into the knee joint from below. These 2 tunnels become the source of the anchor points for the ACL graft. Your surgeon will prepare the harvested hamstring and pull it through the upper hole and into the lower hole, just taut enough to mimic your original ACL. A small grappling hook will anchor the upper end of the graft, and a screw will stabilize the lower end. The screw is usually bioabsorbable, meaning your body will incorporate it into the bone over time. The graft from your hamstring tendon will act as a scaffold upon which a new ACL will grow.
The incisions are then closed with sutures and a dressing is placed.
Operative care. Following the surgery, rehabilitation begins immediately. A physical therapist will teach you specific exercises to strengthen your leg and restore knee movement. Avoid competitive sports for 5 to 6 months to allow the new graft to incorporate into the knee joint.